Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap. But sometimes we don't have that available. When not available, use hand sanitizer that should have at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, conscious about self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they're out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gonna lock down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet.
Is on.
Pleasant afternoon. Welcome to the National Emergency Operations Center COVID-19 briefing for Wednesday, the 14th of July, 2021. I am Les Roy Williams. Thank you very much for joining us for this briefing. I want to recognize among us the Minister of Health, the Honorable Akila Byron Nisbet, and the Honorable Wendy Phipps, who is the co-chair of the Disaster Mitigation Council. We continue to partner with you, the public, in the management of the COVID-19 pandemic here in the Federation. Your part is extremely important in keeping us secure, keeping us safe against the transmission of the deadly coronavirus. Today I'm going to invite first Superintendent Cromwell Henry, who is a member of the National COVID-19 Task Force, to bring us the latest update with respect to the regulations.
Thank you, Mr. Williams. President, good afternoon to all listening to this broadcast via whatever means. New regulations have been published, and these regulations came into effect on Monday, 12th July 2021 at 5:01 a.m. and will expire at 5 a.m. on Monday, 26 July. These regulations do not provide for any 24-hour curfew. However, a nightly curfew will remain for the duration of the regulations. The night curfew commences at 9:01 p.m. and continue until 5 a.m. the following morning. This means that during this period, every person shall remain confined to his or her place of residence to avoid contact outside of the family. Two exceptions are provided. One, essential workers who are required to report for work, and two, persons who have to travel for emergencies. So if you are an essential worker, you are permitted to leave your house if you have to work, and if you have to leave your house for some emergency, be it medical or otherwise. All businesses and enterprises are required to adjust their opening and closing hours to allow sufficient time for their staff and customers to adhere to the night curfew. We strongly recommend a closing time of 8 p.m. However, given the size or nature of your business, it may be best that you close earlier. Persons other than essential workers who are required to move from his or her home during the period of night curfew shall first obtain approval of the Commissioner of Police to do so. So if you're not an essential worker and you're not traveling for some emergency and you wish to leave your home at night, you must first seek permission from the Commissioner of Police in writing, and this can be done through the website www.police.kn. I will now highlight some of the provisions of this new regulation. All businesses and offices may resume their business operations. However, where a business is unable to resume its operations by its employees practicing social and physical distancing, it shall allow its employees to work remotely from home, utilizing virtual means. Businesses and establishments can operate, and they should be guided by the following provisions. One, you must ensure that all customers and staff maintain physical distancing of at least 6 feet in or outside of their business, if in a line to enter the business. Two, you must determine the total number of persons that may be permitted in the establishment at any one time by permitting one person for every 30 square feet of floor space. 3, place distance markers at least 6 feet apart, indicating where each customer must stand in a line at the checkout or a point at the checkout point or other line. 4. Place distance markers at least 6 feet apart on the outside of the establishment, indicating where customers must stand while waiting to enter the establishment. All persons shall wear face masks covering his or her nose or mouth when indoor or outdoors in a public place. Churches. All religious places of instructions or worship may open but are required to adhere to social and physical distancing protocols, the hygiene protocols, and the wearing of face masks. Funerals and weddings are permitted, and the number of persons in attendance will be determined by the size of the venue, using the formula of 30 square feet per person. All persons attending must adhere to the COVID-19 protocols of social and physical distancing, the hygiene protocols, and the wearing of face masks. Regulation 10.7 provides that all street vendors shall operate within the confines of the public market, where an accurate record of all persons visiting the market shall be kept, and this will include their names, addresses, and telephone numbers. All persons using the facilities of the public market shall adhere to social distancing and physical distancing protocols, as well as the hygiene protocols and the wearing of face masks. Regulation 8 restrict mass gatherings. There shall be no mass gatherings. However, limited social activities will be allowed. Permission must be sought from the Commissioner of Police, again in writing, to host these limited events that will be permitted. You may apply through the website www.police.kn. Restaurants and takeaway food vendors may operate for the purpose of food delivery or food takeaway services or for in-dining. However, all COVID-19 protocols must be adhered to. Bars may be opened for the sale of liquor. Again, persons patronizing these bars, including the staff, must adhere to all COVID-19 protocols, which include the hygiene protocols and the wearing of face masks. Salons and barbers and barbershops may open, but no more than 2 persons shall be allowed in the waiting area. Regulation 11 provides some restrictions on buses and other passenger vehicles. The limit on the number of Regulation 11 limits the number of passengers that can travel on taxis and ferries to 75% of the carrying capacity, and no more than 10 passengers shall travel on motor omnibuses. All passengers shall wear face masks at all times, and the windows of the vehicle shall remain open. With regards to sports, management teams and clubs within each sport discipline may apply to the Ministry of Sports for permission to host inter-teams and inter-club competitive matches. Sub-Regulation 3 provides that a fully vaccinated person may attend amateur, competitive, or other recreational sports, and all spectators shall be required to produce proof of full vaccination by presenting a COVID-19 vaccination record or other valid proof of vaccination authorized by the Ministry of Health before entry into any sporting event. The organizers of the event shall ensure that a maximum capacity of 50% of the venue is not exceeded. They shall also ensure that an accurate record of the persons in attendance at the event is kept, and this should include their names, addresses, telephone numbers, the patient number on the COVID vaccination record card, and all persons shall adhere to the COVID-19 protocols. These regulations provide for some penalties for non-compliance, and the penalties are severe. person who contravenes or fails to comply with these regulations shall be liable on summary conviction to a fine not exceeding $5,000 or to a term of imprisonment not exceeding 6 months or to both 6 months or to both. Additionally, compliance officers and police officers may issue fixed penalty notice to businesses or individuals for breaches of the COVID-19 Act. These fixed penalty notices carries fines up to $500 per violation. Again, we prefer voluntary compliance, and we seek the full cooperation of all persons in avoiding these penalties and just comply with all the stipulations of the regulations and all the protocols as you so know by now. Thank you.
Thank you, Superintendent. I now invite the Chief Medical Officer, Dr. Hazel Laws, to present the Health Emergency Operations Center Center Committee Situation Report for today.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, I'll share with you the NEOC Situation Report for July the 14th, 2021. We have been responding to and trying to control this second wave of COVID-19 cases for exactly 8 weeks. So today, Wednesday, July the 14th, makes 8 weeks since we've been responding to this outbreak. Within this time period, we've added a total of 499 cases. Let me pause and share that today we identified 4 additional cases of COVID-19. So within the 8-week period, we've added 499 cases to the Federation's COVID-19 tally. We have a total of 390 recoveries within this 8-week period. And again, within this 8-week period, we have a total of 106 active cases remaining. Now, also within this 8-week period, we've had a total of 31 admissions to the COVID-19 ward at the JNF General Hospital. So over this period between May 19th to July 14th, 31 patients were admitted to the COVID ward at the JNF General Hospital. But it's important to note that as we speak, the COVID-19 ward at JNF General Hospital is void of patients. So at present, we do not have any admissions. And over this period, we have reported 3 COVID-19 related deaths. This map just shows the distribution of the COVID-19 cases between May 19th up to June the 30th. And this shows that the COVID-19 cases are occurring mainly in the areas that are densely populated, St. George, along the East Coast to Christchurch. And then the next map shows the distribution of the COVID-19 cases up to today, July the 14th. And again, the COVID-19 cases are occurring in the parishes that are densely populated. This slide shows the epi curve for the present wave over this past 8 weeks. And you can see that the daily case count peaked between June the 11th to the 23rd. And the curve is on a downward trend. And the graph down the bottom just highlights the number or the daily count over the past week. Okay, so as I said before, we just got data coming in from the laboratory, And today we identified 4 additional cases of COVID-19. So that brings our total federation-wise to 544. So we have a total of 544 confirmed cases of COVID-19, St. Kitts 526, Nevis 18. We have 435 cases fully recovered, and this is since we've been responding to the pandemic from last year to present. We now have 106 active cases. It's important to note that the number of active cases have fallen drastically from over 300. We are now down to 106. And as I said before, we have 0 persons admitted at the JNF General Hospital, the COVID ward. So we do not have any admissions on the COVID ward as we speak. And as I said before, 3 COVID-19 related deaths. Just an overview as to the situation in the prison system. Now, we have identified a total of 55 inmates who've been impacted by COVID-19. 44 of these 55 have recovered, and so we are monitoring 11 active cases. In terms of the staff, 15 staff members have been impacted by the disease. 3 have since recovered, and we have 12 active cases amongst the staff members. Now, it's important to note that the Ministry of Health facilitated a sensitization session for all the staff members at the working within the prison system, and this session was conducted last Friday, July the 9th. So they covered infection prevention and control in the context of COVID-19, and so that's important, and so that's going to improve the efficiency within which they are monitoring the inmates that are isolated in the system. Okay, so as at end of work day yesterday, Tuesday, July 13th, we administered a total of 42,250 doses of the AstraZeneca Oxford vaccine. So that gives us a coverage of 70% in terms of the target population covered with the first dose, and a coverage of 57.9% covered with the second dose or fully vaccinated. So more specifically, 19,119 individuals are fully vaccinated. Now, data coming in from this afternoon tells us that 70.2% of the target population is covered with the first dose, and 58% of the target population fully vaccinated, receiving 2 doses. Now, we've been getting a number of questions in terms of persons seeking clarification regarding the 70.2% coverage, 70.2% of the target population covered with the first dose. Next slide. Okay, so let me just pause and explain. The target population for the Federation of St. Kitts and Nevis refers to the adults within our population. And based on the last census conducted in 2011, it's approximately 33,037 individuals. Now, the adults comprise 70% of the total population. And so the first dose of the AstraZeneca Oxford vaccine have been administered to 23,180 individuals, or just over 49% of the total population. The second dose, in terms of the amount of persons or adults who are fully vaccinated, comes up to 19,065, a little over 40.5% of the total population. So in other words, we still have a remaining 9,900 plus individuals or adults to be vaccinated, so let's say 10,000, we still have approximately 10,000 adults yet to come on board in terms of accepting the vaccine. So in other words, we've achieved 70% of the target population. We still have the remaining 30% of the adults in our population in terms of having them being empowered about the vaccine and coming on board and accepting the vaccine. And I also want to underscore that this data is based on the last census that was conducted in 2011. And so we are now in 2021, and so by extrapolation, I'm sure the actual number of individuals remaining would be a little bit more than the 10,000. So this is just, these figures are like proxy figures to the real numbers. Again, this just underscores, and this just serves to remind you that in our population we have the Lambda variant in circulation. So far we gather that it's more transmissible than the original variant that was in circulation last year. The scientists are still conducting studies with regards to this variant in terms of its virulence and its response to the various vaccines on the market. The contact tracing process continues, and our team of public health practitioners, we've already interviewed and engaged over 2,543 individuals who were placed in self-quarantine, and over 2,200 of these individuals have already been released from quarantine, and at present we have a remainder of about 262 individuals still in self-quarantine, and this is in keeping with the drastic reduction in the number of active cases. We continue testing the cases, we continue testing the contacts of the cases, we continue conducting targeted and random testing with well over or almost 13,000 samples being processed within this past 8-week period. Now, I just wanted to pause and just reiterate or provide some additional information regarding the recent policy change with respect to fully vaccinated inbound passengers. So fully vaccinated inbound passengers who landed on the Federation this week, Monday, July the 12th, or yesterday, or even today, this afternoon, July the 14th, and beyond, such individuals will qualify for a reduction in their quarantine period. Now, this quarantine period is now stipulated as 3 full days, and then the exit test sample, the exit nasopharyngeal swab, will be taken on the morning of day 4, and that sample will be sent to the lab for processing. And so the individuals will be released, officially released from quarantine after a negative RT-PCR test result is received from the lab at the end of day 4. So usually the results come in the evening, the night of day 4. And now this policy change became effective on July the 12th. And so it applies to individuals who landed on July 12th or beyond. And so individuals who came into the country up until July the 11th, midnight, it means you landed under the original health and travel protocols. And so the terms and conditions of your quarantine period is as stipulated in the previous iteration of the health and travel protocols. Now, we've been opened for 3 days now since the lockdown, and so what's the way forward? Well, the way forward involves us living with COVID. And this is a quote that I found in the Wall Street Journal article dated July the 11th. It was Edward Steinham who said, and I quote, "This is a virus that we are going to have to learn to live with, and we are going to have to learn to manage, and we are going to have COVID-19 patients for the foreseeable future." And so our daily case counts are in the single digits as we speak. So today we've added 4 positive cases, and so that's good. And so there are individuals who are of the impression that we are going to be COVID-free again, probably in another week or 2. So no, that's not going to be possible. We are going to continue having or identifying newly diagnosed COVID-19 patients on a daily basis, on a weekly basis, for the next couple of months at least. And so we need to understand that COVID is here and that we need to live with COVID. So how can we exist and live with COVID? How can we live and yet protect ourselves from the virus? And so this is what living with COVID really means. And so living with COVID means wearing your face mask at all times, sanitizing your hands or maintaining good or adequate hand hygiene, maintaining a safe distance of 6 feet or more from others, and boosting your own immune system. These steps, these protective measures are very, very important, all right? Because you do not know where the virus is. You do not know who is infected. It could be loved ones, it could be friends. And so these protective measures are simple ways in which you can protect yourself and your loved ones from the virus. Living with COVID means coming on board and accepting the vaccine if you have not already done so, because it's proven to be a very effective protective measure. Living with COVID means that if you are experiencing COVID-like symptoms, it's important, it's an imperative that you remain at home, seek testing and medical care at the soonest. If you are diagnosed with COVID-19, you will automatically be placed in isolation, either at home or at a facility. And you're expected to remain in the confines of that space for the duration of the isolation order. It's your responsibility to limit the exposure of others to the virus. If you are a contact of an individual who is diagnosed with COVID, you will be asked to quarantine at home or go into self-quarantine. Again, you're expected to remain in the confines of your home for that stipulated period. And if you have COVID, or if you are a contact of a case, and if you're in isolation or self-quarantine, you're expected to adopt the protective measures I just explained in terms of wearing your face mask when interacting with your care provider or the individual providing you meals, etc. You have to maintain adequate hand hygiene and maintain a distance away from your loved ones who may be providing you care during the period of isolation or quarantine. These simple guidelines will help prevent the third wave of infections and prevent another lockdown. We have a personal and social responsibility to adopt these protective behaviors. Let us work together to maintain the health and well-being of our people. I want to just pause again and just share some information regarding the 311 hotline operations. Now, the 311 hotline service was established to facilitate accessibility to reliable information regarding COVID-19. So the hotline serves the general population. So if you are confused about any of the issues related to COVID, if you are in need of medical care or emergency public health services, feel free to call 311. What are the responsibilities of the 311 operators? They are meant to assist nationals and residents who are experiencing respiratory tract symptoms and help guide them and link them with care and testing. They are meant to address callers with issues pertaining to individuals in quarantine and isolation. So if you have any questions, you can call regarding quarantine or isolation or even testing. You can address questions related to the general health system operations during the pandemic. For example, the opening hours of the health centers, special clinics, and scheduling of appointments. If you want to document side effects of the Oxford AstraZeneca vaccine, you can call the 311 operator. They are meant to refer callers who may have psychosocial needs or concerns to the appropriate services provided. So in other words, the 311 operator can link those in need of psychosocial support to the counselors. Please note that the 311 operators, they do not provide COVID-19 test results. I repeat, the 311 operators do not provide COVID-19 test results. They are meant to link callers to allied support officials for assistance. For example, they can link you to the port health surveillance technicians, including updating callers on travel protocols. They can link you with the police for curfew clearance, and social services, Department of Social Services for care packages and financial assistance packages. So that provides a summary of the roles and responsibilities of the 311 operators. Thank you.
Thank you, Dr. Laws, for that comprehensive presentation. I now invite Mr. Abdia Samuel, who is the chair of the National COVID-19 Task Force, and he's also the National Disaster Coordinator at NEMA. Mr. Samuel.
Thank you, Mr. Williams, and a pleasant good afternoon to all our listeners and viewers. This afternoon presentation, I want to start by highlighting that we are expecting the Seaborne Odyssey to make a port of call and tender in the South Friars Bay area on the 22nd of July 2021. In this regard, we are appealing to all the tourism stakeholders who will be participating in this exercise to ensure that they have cleared all the necessary protocols and procedures with the St. Kitts Tourism Authority. We want to ensure that everyone who will be working within this sector has already been cleared to do so through the said Tourism Authority. We are also expecting the Celebrity Millennium to arrive or make a port of call on Port Zante on the 28th of July 2021 if all goes well. With that in mind, we want to encourage persons working in this sector to be prepared. If you have not been vaccinated, go and get vaccinated, and hopefully you can benefit from the arrival of the cruise industry once more. Today, July the 14th, the Early Childhood Development Unit within the Ministry of Education would have opened a number of nurseries, daycare centers and preschools. And these were opened under a set of new processes and procedure regarding the new COVID-19 protocols that were updated. We were also, well, I want to take this opportunity, to appeal to all of those daycare centers, nurseries, and preschools that have not yet gotten the appropriate approvals to please do so. It's our understanding, when I say our task force membership, that there are a number of preschools and nurseries that have opened and have not yet received such approvals. I am appealing for you to go and get these approvals as soon as possible to avoid any form of closure. We have been getting a lot of questions about OTI, and I want to repeat once more. The Ocean Terrace Inn is not being utilized as a quarantine facility for incoming passengers at this moment. So I am advising you to seek quarantine or vacationing place services at one of the government designated facility. In that of the Koi Hut Resort, you have the Royal St. Kitts, the St. Kitts Marriott, St. Kitts Vacation Club. You also have the Park Hyatt. And by extension, you could also seek quarantine services from Parkworks in Nevis. All you have to do is contact Dr. Judy Nisbet. My colleagues before me would have addressed the situation regarding how do we build resilience. And in this regard, I want to bring to the attention of the general public the fact that we continue to increase our resource pool or base by conducting a number of consultations and also engaging with our regional and international partners. Just yesterday, I was informed by the HAP division of the U.S. Embassy in Bridgetown, Barbados, that the field hospital that NEMA would have engaged the HAP division on would be arriving in the Federation in August, at the end of August this year, so that our capacity to be able to have more hospital beds in the field will be increased. So we will be having a 40-bed field hospital. One will go to Nevis and one will come to St. Kitts. Ladies and gentlemen, I want to commend, now that we are reopening slowly and gradually, I want to commend a number of key stakeholders who have assisted us in this regard: the Chamber of Industry and Commerce, the clergy, a number of NGOs, small independent businesses, and of course our citizens and residents. We are now nearing the peak of the 2021 Atlantic hurricane season, and the peak begins in late August to late October, in the middle of August, to late October. And in this regard, I am appealing to our citizens, residents, and even visitors to continue the hurricane preparedness measures. So with that said, we want to commend and thank everyone for their good discipline, order, and contribution to the lockdowns period that we went through. And we are hopeful that we don't have to go through these periods again. Thank you again, and all the best. We now await your questions.
Thank you, Mr. Samuel, and I would start the ball rolling with the questions. The first question: those who were infected with the virus and had their first dose, when will they be fit to take the second dose? Or would they have to start all over again?
The way I understood the question, somebody would have had their first dose and then got infected, and you're wondering when they can have their second dose. Now, once you were infected, you would have some level of protection, but the science has shown that the antibody levels or the proteins that you develop to protect yourself against COVID-19, they wane after about 3 months. And so once you are deemed fully recovered, you actually can have your second dose right after you get your 2 negative tests or any time in between that 3-month period.
Thank you, Dr. Wilkinson. This question is from SKN Newsline, Mr. Glenn Bart. Could someone comment on the reports that the European Union Regulatory Agency will not approve the AstraZeneca vaccine manufactured in India? It's at the Serum Institute. Is this a geopolitical strategy to keep certain people out of Europe? Or are they implying there is something wrong with the India-produced vaccine?
What I can tell you, first of all, there is nothing wrong with the AstraZeneca vaccine that's produced in India, and we know that it is working well based on the decline in positive rates that we've been seeing in countries that have been having their people vaccinated with that vaccine. The World Health Organization has been lobbying with all of these different agencies in Europe and around the world to ensure that all the vaccines that are approved by the World Health Organization, that they will be accepted by all of these countries. And I'm pretty certain very soon you would see a change.
Next question. Is the completion of the SKN Travel app with its pre-arrival approval requirement still in effect for fully vaccinated returning nationals? Or can such individuals simply provide proof of vaccination and negative RT-PCR test upon arrival? Chief Medical Officer.
So if you're fully vaccinated, that's what they're asking. All right, so if you are fully vaccinated, you are, well, all inbound passengers to the Federation must log on to the KNA travel form .kn URL and complete the entry form. You are expected to upload a negative RT-PCR test, that's pre-arrival, and then you are also expected to provide us a copy of your vaccination record card or certificate, and then your approval will be vetted based on those submissions. And so all of these documents are required upon, in order for you to be considered and granted approval to enter.
Thank you, CMO. Based on the CMO's explanation, the target adult population of 33,037 appears to include elderly persons who are too vulnerable to be vaccinated. Please clarify. If this group of seniors is excluded from the target population, approximately what percentage of the total population can be vaccinated? Also, given that the calculation is based on the population figure of the census undertaken since 2011, is there any more recent demographic information available to determine a more realistic estimate of the target population?
Okay, so based on the last census, and this is information coming out of the Department of Statistics, 2% of the total population comprise individuals 81 plus. And so that speaks to the older adults who are fragile, etc. So that subset of individuals comprise 2% of the total population. So actually, they weren't included in the 70% or the target population that I referred to, the 33,037. And by extension, the Department of Statistics can provide us estimates that we can utilize now ahead of their completing the census that's ongoing.
I just want to add, though, that just because someone is over the age of 80, it doesn't necessarily mean that they cannot take the vaccine. These persons will be assessed, and if they're deemed physically fit with no significant untoward effects, they can have the vaccine. And so we have had a significant number of persons. I'm pretty certain there are persons out there looking at me now and saying that I am 83, I am 84, I'm 88, and I had the vaccine and I'm doing well. We also keep saying, though, that we are looking to have a significant proportion of the population vaccinated. I'm very happy that the vaccination figures have shown that we have crossed 70% of the adult population, and that is significant. We'll continue to encourage those who can be vaccinated to come forward and get vaccinated, because the higher that figure becomes, the better protected we are. So we're not looking at any one magic threshold figure to say we reach 70 or 80 or 90 and then everything goes back to normal. We must continue to push to get as many persons as possible vaccinated. And hopefully, as we said before also, later on in the year or next year, if we have the Pfizer vaccine available to us that can be given to persons between the age of 12 to 18, that will also push our threshold of immunization even higher so that we can open up safely and absorb more risk.
These three questions are referring to sports and entertainment. We have the Minister of Entertainment here. Why is it that CPL is being deemed a vaccinated-only event? However, exceptions are being made for CPL technical group and players from overseas to be unvaccinated. Also, children who cannot be vaccinated are allowed to attend. Why are we causing segregation and discrimination with vaccinated and unvaccinated at entertainment and sporting events? Industries such as bars, churches, education, supermarkets, hotels, and others do not have to operate under these conditions of only having vaccinated customers or attendees. So why does entertainment and sports have to operate on these non-favorable conditions? CPL is heavily funded by the government of St. Kitts and Nevis with taxpayers' dollars, and citizens who are both vaccinated and unvaccinated contribute. Why is the unvaccinated adult population of St. Kitts and Nevis citizens being disenfranchised from attending the CPL games, while children under 18 who are less disciplined and players and technical staff are afforded this privilege?
Well, first of all, let me start by saying that there is no discrimination against the unvaccinated, and we need to stop speaking about unvaccinated as if it's a race or gender that cannot change. Our fight, as I said all along, has been for the unvaccinated. We have been trying to get as many persons who can be vaccinated so that we can protect those who cannot be vaccinated. And those who cannot be vaccinated include our young folks who are below the age of 18. And so there is no discrimination at all. We are encouraging you above the age of 18 who can be vaccinated to get vaccinated so you can protect these persons. Our fight has also been for the pregnant mother and the unborn child who cannot be vaccinated. And so there is no discrimination against those persons at all. By us encouraging you out there who can be vaccinated to go forward and get vaccinated is so that you can protect those persons. Our fight has also been for the elderly and frail who cannot be vaccinated. And so there is no discrimination against those persons. We are encouraging you again who are out there who can be vaccinated to go forward so that you can protect these persons. As it relates to mass events, and CPL is a mass event, we know that mass events can be super spreaders. And so in the first instance, as we are moving forward with mass events, we are saying that they can be safely done with vaccinated adults. And if one wants to go to the CPL and you can be vaccinated, then you can simply go forward and get vaccinated so that you can attend the CPL game. There is no discrimination at all. And so by having a crowd or spectators attending the CPL who are vaccinated, we know that the chance of getting a super spreader event emerging from this is significantly decreased. We also know that children cannot be vaccinated, but they can go under the umbrella of their parents or their guardians. And so if you have a family of 5 adults who are vaccinated and there is a child who is 14 who wants to attend the game, they can go and they will obtain the herd protection from the family and the other persons who are there who are vaccinated to ensure that they may not get infected. As it relates to the players, they're in a different bubble and there will be no communication between the players and the spectators.
Thank you, Dr. Wilkinson. This is another question. How long after those persons who would have been infected with the COVID-19 virus, how long after would they have to spend before taking the vaccine? And secondly, someone is also asking that if someone would have had the virus, that there is some natural immunity that they would have developed if such persons can attend the CPL because they have some level of immunity even though they have not been vaccinated.
Right now, the rule to attend the CPL is a vaccinated adult or children with their vaccinated parents or guardians. And so I think that answers that part of the question. If you were infected and you recover, which means that your symptoms resolve and you had 2 negative tests indicating that you're fully recovered, you can start your vaccination. However, we also say that in a situation, I'm not talking about in St. Kitts in general, but in a situation where vaccines are scarce, they would ask persons who have recovered to wait a maximum of 3 months before they get vaccinated, knowing that they would have had antibodies to protect them and allow other persons who were not exposed to get vaccinated. Here in St. Kitts and Nevis, there is no waiting period, and so once you have recovered, you can come forward and get vaccinated.
This next question. Some places like supermarkets and certain other establishments ask customers to write their names, addresses, and they record the temperature, etc., in a logbook. What is the purpose of this procedure? Is this one of the regulations? And if so, which regulation is it? Superintendent, Dr. Wilkinson.
In the recording of the, well, first of all, the persons who are at the supermarket checking your temperature and making sure that you hand sanitize. This is to make sure that you are not symptomatic and entering the supermarket. Those persons who are taking a log, it is for contact tracing. And so if, for example, you were to go to establishment X tomorrow and your name was written down in a book, and we discovered tomorrow afternoon there was a worker there who tested positive, we can look at the logbook and contact you and see whether or not you were in close proximity to this worker X. And that is how contact tracing is done. And so the taking of the log, it will be called upon if there was an outbreak so that we can track the persons who were at the establishments.
Okay, and the last question is for Superintendent Henry. It has to do with the cost of security at a home, if you're home quarantining, and if you want to quarantine at home, what is the cost of security?
Yes, we have established the cost of the security for the private security for home quarantine at $20 per hour for the duration of the quarantine period.
Thank you very much for your questions, and they were all answered. This brings us to the end of the question and answer segment. I want to thank all of those who came and answered the questions. I thank Dr. Cameron Wilkinson, our Medical Chief of Staff, who continues to avail himself to answer questions at these briefings. We also thank the Chief Medical Officer, Dr. Hazel Laws. We thank Mr. Abdias Samuel, the Chair of the National COVID-19 Task Force. We thank Superintendent Cromwell Henry. We thank Mrs. Christmas Jacobs for her service of sign language. We thank the Honorable Akila Byron Nisbet, the Minister of Health, and the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council. Additionally, we thank Dr. Marissa Carty. She's always behind the scenes, but she's working extremely hard. And we thank ZIZ, and we continue to thank you who continue to pay attention to these briefings. We thank the media for continuing to partner with us in the dissemination of information so that the public can be aware of what is happening. That is all a part of the management of the pandemic here in St. Kitts and Nevis. Thank you to all of you for joining us, and we will be back some point next week for another COVID-19 briefing. Take care. I am Les Roy Williams.
Yeah, I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, yeah. One people. We are roll up to roll up, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. yeah. It's better for us. Tell your mommy to let it roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.